So I think we'll just start off, talk more about your decision to extend the Georgia state of emergency through June 12th and why that's important.
Well, I had some conversations with Lieutenant Governor Duncan and Speaker Ralston, and they both agreed that we needed to extend the order. That gives us the ability through the Department of Public Health and other emergency powers to continue all the good work that we've been doing in recent days to ramp up our testing. We've seen, a record day this week and really some exponential growth there, and we need to continue to do more. But it also allows me the ability from a waiver perspective dealing with, potential outside doctors and nurses from outside the state coming in, hospital bed capacity issues. There's just a lot of reasons to extend that to make sure that we can have 100% response to COVID-19 in the state of Georgia.
You've talked a lot about extending that hospital bed capacity and also the number of ventilators. Where does that stand, and how much has that factored into your decision to go ahead and lift the overall shelter in place?
Well, it's a big part of it. I mean, that's some of the data that we're following, those numbers literally every day. I get an update 7 days a week on that. We had the lowest ventilator use today than we've had in a long time. Our hospital bed capacity continues to be in really good shape. And that's really what all these previous orders were doing, was allowing us time to help flatten the curve and really build up that capacity. And now that we've done that, I felt like it was time for us to move forward. Continuing to focus on the people that are really affected by this. That's those that are in long-term care facilities, the elderly and the medically fragile, but also easing up on the shelter in place for other Georgians, because they have done what we asked. They helped us flatten the curve and build that infrastructure out, and also, get our testing and contract tracing is starting to ramp up as well.
People have done what the state has asked for the most part, and how important is it now moving forward that people continue making some of those personal decisions about how much they're out or whether they wear a mask? A lot of people just going to have to make day-to-day choices about how they move forward.
Well, and I think that's really the message I have to people is, number one, thank you for helping us flatten the curve and have the time to do all of this work and be prepared. But also, I feel like it's time to free them up a little bit. It's time to get our economy back started. We cannot continue down this road. We're going to have depression-like unemployment if we do, and we're going to have people that are, going crazy trying to get food and medicines for their families. And that's not what we want in this state or what we want in this country. And we're taking a measured step forward to allow that. But we've also got to continue to have our citizens be part of the solution and not part of the problem. We still have the social distancing requirements in place. We have the large gathering ban in place. We're continuing to keep some establishments closed, like bars and nightclubs and entertainment venues. We'll continue to watch the data as we move into phase 2 about easing up on that. But even though we're freeing people up to move around a little more than they have, we do need them to wear a mask if they're going to the grocery store or going to the pharmacy. I've talked to Dr. Toomey about that. That's what she does. But when she goes to the neighborhood park to walk her dog, she's not wearing a mask because she can socially distance herself from people. She's in an open air environment. So we just need people to use that good common sense. And I know our business community, those that decided to open, and that was not a mandate, that was a choice, they have done a great job of following the guidelines that we have to protect themselves, their employees, as well as their customers.
One of the most common questions we're getting is about the numbers, people seeing the number of cases going up. Talk about what you're seeing with the curve and those case numbers.
Well, there's a lot of different metrics, Cheryl, that we're following every day, and I know it is kind of counterintuitive to people when they see the number of cases that are going up. That is actually a good thing because it means that we're testing more. But what else is good that we're seeing right now, we're really watching this trend. The number of cases, the number of tests are going up, but the percentage of the positive cases to the number of tests continues to drop. And that's what we want to continue to see. So we're testing more, but the number of positives we're getting, that percentage is dropping. So that is a very good sign. You know, we're not going to get rid of the virus. None of these things that we're doing is designed to get rid of the virus. It's designed for us to be able to have the healthcare capacity and to meet the needs of any patient in Georgia that needs, you know, a hospital bed or needs medical attention. That's what, you know, the guidelines at the federal level were designed for. We meet those guidelines to move into phase 1, so that's what we've done. But we got to continue to make sure that as we're going to see community spread, we don't need it to turn into a hot spot or an epicenter. If people are following these best practices, you know, we're going to continue to see these good numbers that we have as we go forward.
You know, doctors have said there's so many unknowns. The what next is always the big question mark. How much has the state talked through potential next steps as we see the impacts unfold over the next couple of weeks?
Well, I continue to be in touch with a lot of our hospital CEOs on the bed capacity issue, and actually these discussions about, you know, slowly reopening Georgia's economy, they were a big part of that. They got so many empty hospital beds, they're becoming financially not viable. That is a big concern to them. That's the last thing we need is for our hospitals, you know, to start laying off nurses and doctors and closing their doors because they're not financially viable. You know, we've sent a signal that they can start some of these elective surgeries back that'll put people to work, but also get some good health outcomes for their patients. So, you know, they're in support of those type things. But everybody realizes, and, you know, we're hearing this certainly from the White House and Dr. Birx and Dr. Fauci, you know, everybody's got their eyes on the fall. Once we kind of get through where we are now here, hopefully the next 2 or 3 weeks, next month or so, move into a different phase. You know, we also got to prepare for a rebound this fall if the virus comes back. You know, who knows what that's going to look like? Who knows if we won't have, you know, medical treatments available? Then there's some promising things out there, potentially a vaccine. You know, I'm not the expert on that. There's a lot of really smart people working on that issue, and I certainly hope and pray that they're successful. But a lot of the things that we're doing, we stood up to be in place for a long time. We knew this wouldn't be over in June. It may be calmed down in June, and life may go back to a relatively normal format. With certainly a new world order from social distancing and things of that nature. But we also know that we got to prepare for this to come back in the fall and continue to do that, quite honestly, until there is a vaccine or some sort of medical treatment.
Just one step at a time, I guess. Governor, thank you so much for the time. Appreciate it.
Thanks for having me on.